there is a role for AI. There is a role for AI in helping capture triage, helping capture data points, helping analyze data points. But ultimately, I think the human oversight and that relationship is the piece I'm talking about, right? And can that be done better, faster, and at scale with all of this technology? Absolutely. I think there's no other way to do it. But it's understanding what we're pointing and shooting the technology at that is critical to the success of scaling all the things that I believe the question is being geared towards.
Yeah, no, that's a great point. And I think the scaling issue is always an issue. I'm curious, Vinita, your thoughts, because if someone's listening and already motivated in the short time we've had to say, okay, I need to focus on well-being, I need to have humanity at the core, what do you say to the challenges of scaling and of thinking about how to get everybody that care? You know, care equity has come up a couple times. Are there certain things that we can use in that way to avoid the pitfalls of we'll scale to everyone and then we kind of scale to no one?
Yeah, no, it's a great question, and I read this stat, and Dr. G, you can confirm it or not, but I've heard 2/3 of the time that a physician spends today is on administrative tasks, and that's a lot. If that can be reduced by even a third, that allows scale, right? It allows them to spend more time with the patient, allows them to spend more time doing what they went to med school for, and what they love to do and what they're great at. So can technology help with scale by reducing administrative tasks that are inundating our care teams today? Can we provide more information and make it handy for the care team? So when they actually see the patient, they have so much information in hand that they're not asking the same questions again, right? How do we ensure that they have the most, impactful experience with the patient, and the patient has the best possible experience with their visit? And how do we ensure that they get all the information that handy, so they spend most time, the entirety of the time, solving for the problem that the patient has showed up for?